I'm Dr. Samuel Acuff, a research scientist at the Recovery Research Institute in the Department of Psychiatry at Massachusetts General Hospital. I'm here with Dr. David Eddy, who's the Associate Director of Clinical Translational Recovery Science at the Recovery Research Institute and an Assistant Professor at Harvard Medical School. How's it going, Dr. Eddy?
Well, great to be here.
Great. Yeah, we're going to talk a little bit today about recovery residences. What are recovery residences?
Well, recovery residences, sometimes called sober homes or halfway houses, are essentially sober living environments. People, often in early recovery from substance use disorder, can live in a safe and secure environment that's free of alcohol and other drugs.
Yeah. What kind of services do they provide?
Well, recovery residents, of course, provide a safe place to live, first and foremost, and that's really important. And it's also important that that place is free of alcohol and other drugs, because, of course, if you're living with people engaged in active substance use, it can be very hard to overcome a substance use disorder. But these kind of residencies also offer a tremendous amount of peer support, individuals helping individuals, the residents helping residents along their respective recovery journeys.
Yeah, I was going to ask who typically runs recovery residences. Sounds like people with some lived experience.
Well, typically, there's different kinds of recovery residences. So on one hand, we have houses that are completely run by the individuals who live there. Financially and all the day-to-day decisions about the house and who lives there are managed by the individuals residing there. Oxford houses are a prototypical example of that kind of recovery housing. But then there are also residencies that are formally managed and operated as well, where there is a little more, perhaps, professional accountability and support.
Yeah, that's really helpful. So what do you know about the benefits of recovery residences?
There's been quite a lot of research done on recovery residences, and overall the results have been positive. We know that recovery residences can help people initiate and sustain addiction recovery. We also know they lead to better employment outcomes, reduced criminal justice involvement, and just generally better engagement and retention in treatment as well.
Yeah. Sounds like really good evidence so far from the studies that have been done. Is there any cost to engage with these services?
Typically, yes, and that can range a great deal. So on one end of the spectrum, recovery residents might cost a small percentage of somebody's monthly income, but other recovery residences might cost more, depending on where they're located and the kind of services they're offered.
This is really helpful information. If someone was looking for more, where could they find information about recovery residences?
Yeah, you can go online and look at the National Alliance of Recovery Residences. They have some great resources there. They also vet recovery residences. And so you can actually check, if you're looking for a residence, you can check with their website and verify that a recovery house has actually been checked out and verified and been approved, as it were. Also, the recoveryanswers.org has a special topic section, which has a tremendous amount of resources around recovery housing.
Yeah. Thank you so much.
Thank you.